Hello, hello, hello. My name is Darren Kent, and I am the Chief Communications Officer of the AME Zion Church, as well as the editor of the Star of Zion. Listen, we are here this evening in order to bring you a special program produced by the Star of Zion and featuring our health director for the Amy Zion Church, our newly appointed health director, Dr. Yabo. Listen, she's been doing a dynamic work. We're fresh out of the Board of Bishops meeting, and maybe she'll drop a little bit of insight as to how that went. I think it went excellent from our perspective, just looking from the outside in. We had new innovative ideas that were being brought to us from a health perspective, and things that the collaborative effort from those who have done the good work in the past and those that are doing it now really just came together and blessed our entire denomination during that meeting. So I'm so grateful to know her. I'm really just introducing her, as well as dropping a little bit of a plug here for the Star of Zion, as I always do when I get this opportunity. Please subscribe to the Star of Zion. If you don't know what it's about, go to starofzion.org, starofzion.org, and look and peruse and check out all of the good things we have going on in the Amy Zion Church, articles that Dr. Yabo has given us in recent. We have a health and wellness editor, Brother Damon DeLeon, who has brought to us a good work when it comes to the health world as well. And just writings from all of our denomination. Listen, you can submit as well. So don't feel like it's the paper that you just look at and spectate, but you can actually participate and submit work and submit your submissions via the website. So go to starofzion.org, look at the top section, and check out our publishing tab and have that reviewed in order to see if you can be published under the Star of Zion banner. Even the great presenters and doctors that we're going to have on today, I implore them to look at that tab as well, and maybe they might want to submit in the future. I know they're looking at me in the waiting room like, oh, okay, all right. But listen, I'm really going to get out the way right now. I'll come back toward the end just to close things out. But I'm going to bring on Dr. Yabo Solo, who is our health director for the AME Zion Church. Dr. Yabo, how are you?
I am doing well, and thank you so much, Brother Kent, for your warm welcome. And again, thank you to the Board of Bishops for this opportunity for us to really speak to our congregation and community. So thank you. Yeah, go ahead.
Welcome for that. Listen, I'm getting out the way. I am going to sit back and mostly spectate on this important conversation that we have about prescribing positivity. That's going to be the theme that we're going to be doing for at least this year, and we'll see how far it goes in the future. But now we're talking about getting to the heart of the matter, right? For Heart Awareness Month. Am I correct in saying that?
That is absolutely right. And we just welcome all of you out there in our virtual world to this first in the series of Prescribing Positivity. And this is where the Office of Health Ministry of the AME Zion Church, we're inviting members of varying health specialties. We're talking about heart doctors, kidney doctors, nutritionists, mental health specialists to really join us, share their expertise with our congregation and communities. And we wanted to start off, since this was Heart Month, with, of course, talking about the heart. And when I looked at some statistics recently, really scary, according to the American Heart Association and the CDC, heart disease is the leading cause of death for men, women, and people of most racial and ethnic groups in the US. One person dies every 33 seconds in the US from heart disease. And in 2021 alone, nearly 700,000 people died. That's 1 in 5 deaths was caused by heart disease. But, today we're prescribing positivity. We're delighted to have two of the nation's experts in cardiology, specialists in heart disease, share some insights with us into what we can do to prevent heart disease. What are some of those warning signs in both men and women, because it's a little different. If you already have heart disease, what can you do to manage it better? And also, most importantly, what questions should you be asking your doctor by your health or your family member's health? So they're going to make it plain today. So let's bring them in. Thank you.
All right, you're welcome.
So I will go alphabetically, and we have two esteemed gentlemen. On the panel today, I'm honored to present Dr. Melvin Eccles. He is the American College of Cardiology's Chief EEI Officer. He's also an Associate of Medicine Professor in Cardiovascular Disease at Morehouse School of Medicine, where he also serves as the Associate Director of Clinical Research for their Cardiovascular Research Institute. He focuses on heart failure in underserved populations. He's conducted research on heart failure, healthcare quality, clinical trial equity, and addressing healthcare disparities. His clinical practice emphasizes serving a diverse patient base. So his affiliation with all of these associations, including the Association of Black Cardiologists and other prestigious organizations, all of those attest to his esteemed position in the medical community. And his commitment to diversity, equity, and inclusion in the medical field is evident in his current role. So we welcome you, Dr. Eccles, to the stage today. Next,
Thank you so
yes,
much for having me.
you are welcome. And next, our other esteemed panelist is Dr. Keith Ferdinand, who's currently serving as the Professor of Medicine at Tulane University School of Medicine. Dr. Ferdinand has had several esteemed roles, including being Professor of Clinical Pharmacology at Xavier University, Clinical Professor of Medicine at Emory University. He received his medical degree from Howard University College of Medicine in DC, member of the Association of University Cardiologists. He has also been past chair of the Association of Black Cardiologists, and he serves on the National Hypertension Control Initiative advisor. You may have heard of the Million Hearts Initiative with the CDC. Recently selected a National Castle Connolly Top Doctor of 2024. He's also conducted a lot of trials in high blood pressure, lipids, or cholesterol, especially in racial and ethnic minority groups, has several publications. And one of his passions right now, he's co-investigator of a study called the CHERISH study. It's a church-based health intervention to eliminate some of those inequalities we see in heart health. So I want to welcome again Dr. Ferdinand as well to the stage.
Thank you, Dr. Yabo.
And thank you both so much for joining us. As I mentioned previously, we have such tremendous expertise here. We want to lean into this. So we encourage you during our conversation this evening, please be sure to type in your questions and we'll get to them. So again, we talked about February being Heart Month. So we want to begin by addressing heart health in our community, in the Black community. So we'll start with Dr. Ferdinand. If you can just kind of give us, what's the state of affairs when we talk about heart health?
I'm going to address the positive because that was our charge. We know that physical activity, avoiding excess fat and salt, losing weight if you can, taking your medications, all can help save lives. Now, the downside is that we probably are not doing as well as we can. There's a white-black death gap. African Americans, non-Hispanic Black adults die earlier and die more often from heart disease and stroke. But we're going to say what we can do to make it better. And Dr. Yelbo, one thing that you said that I don't want us to forget is that we should all learn how to communicate with our doctors and nurse practitioners and others. Don't be a passive person and let the healthcare system just throw you around. Know your numbers. Don't let the doctor say your blood pressure's a little high, your sugar's a little high, your cholesterol's a little high, see you in 3 months. Well, what was my glucose, doctor? And he's going to get a little shook up because some of them don't know that you know. But I think that's my message is empower yourself, do shared decision-making. Don't be a passive vessel in your healthcare.
Amen. Amen. So you've really set the stage for us. So Dr. Eccles, Dr. Ferdinand has shared with us some of those gaps. So what is heart disease? When we talk about heart disease, what does that mean? I think you're still on mute. Mm-hmm. There we go.
All right. So, heart disease can mean a lot of different things. It can mean anything from building blockages in your arteries or your vessels around your heart. It can also mean having dysfunction in terms of the heart squeezing function or relaxing for that matter. That's called heart failure. And then there are a host of other things that are lumped under what we consider cardiovascular disease. So anything that happens to the heart and the vessels, like strokes, things like that, they're all related to what we call cardiovascular disease.
Okay. So, what are some of those signs that we should watch out for when we say someone has heart disease, or if you don't know, like what should you start looking out for?
So heart disease, first of all, I like to make sure we kind of separate just a little bit because there are different treatments for different types of heart disease, and so I'll say, well, let's just take heart attacks, and let's take heart failure. So first of all, before I begin, I want to make sure that I put a plug in for something that Dr. Ferdinand always makes sure that I remember. Hypertension is the number one killer of everyone globally in terms of cardiovascular disease. So that we need to know. All right. So high blood pressure. We can't go anywhere until we stop with that fact. All right. Now,
Okay.
secondly, you can have acute conditions that are or conditions that come up out of the blue, like a heart attack. And I usually tell my patients, sometimes the heart attacks don't always come like and you all will know this reference. Actually, some of my patients don't now that they're younger than me, but you all remember Fred Sanford, that Fred Sanford heart pain.
The big one.
Yeah, exactly. Exactly. So I said, you don't always have to have that, particularly in women.
That's right.
And it can be very different symptoms. And so really what I usually tell people is, number one, like Dr. Ferdinand says, know your numbers, know when your blood pressure is high, when you need to get treatment, but also know when to go to or get help. So go to the emergency room or call someone if you're feeling something that you've never felt before. You don't really know what it is, if it's centered in the chest or anything like that. I advise you to get it checked out.
That's awesome. And I think Brother Ken has a graphic up there that kind of shows what some of those signs and symptoms are. And he'll probably cue that up for us in a minute. You mentioned something I want to touch on, and I'll ask Dr. Ferdinand to expand on this for a little bit. The difference in how heart attacks can show up in men versus women. So, Dr. Ferdinand, we'll start with you while Brother Kent keys up that graphic.
Dr. Eccles and I have been knowing each other for years. I actually use the Fred Sanford syndrome, I call it, because Red Fox did such a great job. He grabbed his chest and staggered back.
Yep.
But what most of us don't know is that he actually died from a heart attack while filming. In women, sometimes it's not necessarily the same type of symptoms. You can just get sweaty. You can get tired or fatigued. Sometimes the pain is in the jaw, in the back. And even in some persons, because the bottom part of the heart sits on top of the stomach with the diaphragm right above that, you can actually get sick to your stomach and be having a heart attack. So what Dr. Eccles was suggesting is that anything that's really unusual, especially if you're sweating, you're short of breath, even if you don't have typical chest pain, it still could be heart disease. And the most important thing is to recognize that if you have hypertension, diabetes, history of smoking, high cholesterol, then you're at increased risk. And we should talk about risk a little bit, Dr. Yabo, because we put
Sure.
so much emphasis on symptoms.
Mm-hmm.
But a person who has very high blood pressure, the cholesterol is very high, diabetes, even if they're not having symptoms at that time, they're at increased risk. And the way I explain is the following. You're on the interstate, you're going 60, you're moving pretty nicely. These young boys will come past you on a motorbike doing 110. They go so fast that they pop wheelies. The bike front wheels go up in the air. They feel great. It's very risky. So risk, we should talk about risk and how we should control those risk factors and not just wait till you have the Fred Sanford syndrome.
That's right. So, you both are really practical. What are 3 things I can start doing tomorrow morning to decrease my risk for heart disease?
Dr. Eccles?
So tomorrow morning. So, I'll say it like this. The first thing you can do before tomorrow morning is get a good night's sleep. Okay. So sleep has actually been shown to, or decreased sleep has been shown to increase your risk for cardiovascular disease. So that's the first thing.
I
Make
agree.
sure make sure you're getting a good night's sleep. The second thing So if you have hypertension, or if you have diabetes, or if you have cholesterol, take your medicine. I know it sounds very simple, but if you take your medicines in the morning, that's the second thing that I say you absolutely need to do, because a lot of people feel that some of the medicines that they're on are not necessarily working, or they feel like they could be on something better. But the question that you have to ask yourself is, are you really taking it like it's prescribed? And if you are, and you're having problems, then that is something that we need to fix. But if you're not, I would try fixing that first. So taking it every day. And then the third thing, I would probably just say, watch what you eat. Now, obviously, that goes to say a lot of different things, but obviously, we're trying to stay away from a whole lot of fat, a whole lot of what we call carbohydrates or starches, and so it's one of those things where I would just sort of watch my portion size for breakfast. So take my medicines, get a good night's sleep, watch my portion size for breakfast. Those are the three things.
Awesome. Thank you. Thank you. And both of you mentioned numbers there, and you're talking about hypertension, which, the other word for high blood pressure. So, Dr. Ferdinand, tell us a little bit about those numbers when we talk about high blood pressure. What should we?
I think we had a chart with those numbers on it, Dr. Yabo.
Yes. Yes. If we could pull up that chart, Brother Kent. There we go. Great.
So let's start at the bottom, the red. The red is when your blood pressure is high. And you're measuring the pressure in the arm, but it really is not the pressure in the arm that counts. We measure the arm because it's out there. It's when it's inside, it hits the organs, it hits the eyes, it hits the heart, the kidney. Someone in the chat mentioned we should talk about kidney disease, and she's absolutely correct. In the Black community, there are 3 times more people on dialysis than predicted by the population. And I don't know where you guys are, but whatever city you're in, if you just walk up into a dialysis unit and take a peek, you're going to see a lot of young Black people on the kidney machine getting their blood cleansed for 3 to 4 hours, 3 times a week. And that's driven by those numbers that are in the red. We really start in the orange, 130 over 80. We used to do 140 over 90, but what we recognize that if you wait until you're 140 over 90 to treat high blood pressure, then you double your risk of a heart attack or stroke. All right, well, let's go on the other side, because we say be positive. The positive is the green. A normal blood pressure is 120 over 80 or less. Now, older persons are really going to have trouble getting that normal blood pressure. That's why Dr. Echo says if you have high blood pressure, take your medicines. A lot of younger people are going to have that 120 over 80, 110 over 70, but it's not for life. Mark Twain said, youth is wasted on the young, meaning that when you're young, you think you got it going on because your blood pressure is fine when you're 19. I'm not worried about it. Well, when you get older, the blood pressure will elevate. So let's stay in the green if we can while we're young, 120 over 80. And then if we're older and we're in the red or the orange, let's seek appropriate care because we're human beings. God gives us free will. We can change. We're not going to necessarily have to have these conditions. And it's not because we're Black. It's because we're not doing the right things to prevent and to treat these conditions.
Teller, thank you.
That's a perfect way to put that, Dr. Ferdinand. And I want to make sure that, unfortunately, we often see more times than not people walking around in the red and the I guess the high orange than anything else. And oftentimes when you have blood pressure that high for a long period, it's almost like you don't have any symptoms. That's why they call it the silent killer. But there actually are symptoms. And what I try to tell my patients is, especially if we're going from one level to another, I've had a lot of patients say, "Oh, doc, this is my blood pressure. It's always been this way. I've been taking medicines for 20 years." And so I try to say, okay, well, I get that. So let's try these regimen. Let's try this regimen first. And then along with it, I make sure that number one, people understand what I'm asking them to do. So when you prescribe medicines, it's more than just writing on a little blue sheet of paper and going away. What I often do is put it in very simple terms on a piece of paper so you can take it home and say, well, what did Dr. Eccles say? Oh, I have it. It's right here. So we go over that. That's kind of like my homework for people, to make sure you know what you're taking and when you're supposed to be taking it. And so that's incredibly important. And a lot of times, whenever we do this and our blood pressure comes down, after a few weeks to a couple months, people come in and say, I feel like I have more energy. I think, yeah, these blood pressure are working. And they're absolutely right. A lot of times fatigue, even though you don't necessarily associate it with high blood pressure, can be one of the only symptoms. And if you have diabetes, it's even worse. And so these numbers that you see here, this is, for normal, what we consider for people who have just hypertension without diabetes. But if you have diabetes, it's extra hard on you. And there's an extra increased risk of stroke, heart attacks, all of those things that are related to heart disease.
Thank you. Thank you. And before we pivot for a little bit, you mentioned, again, with the number, someone asked about those smartwatches. Are they reliable measurements, say, for your blood pressure?
Not at this time. The devices are out there, but they don't have the same accuracy. If you want to get an accurate blood pressure device, there's a place called validatebp.org, VALIDATEBP.org. It's a nonprofit. They're not trying to sell you anything. And there's a list of all the various devices which have been shown and tested to work correctly. And you can order those, get them shipped to your home. You don't have to get the most expensive. Anything that's on there is going to be validated. But at this particular point, if you go to the FDA website, they don't recommend the wrist watch as a means of measuring your blood pressure. They like the valid cuffs, the electronic cuffs that seem to work very well.
Excellent. Thank you for putting that in the chat as well, Brother Kent. So I wanted to go back to taking your medicines. And we'll start with you, Dr. Fernand. Tell us about the dangers and the positives of taking your medicines and not taking your medicine.
So, as I said, we have free will. We can change our environment. And I've been doing this for a long time. I've done a lot of clinical trials. We used to do what's called a placebo-controlled trial. A placebo is the sugar pill, doesn't have any action. So you take one group of people who have very high blood pressure, you put them on a medication. You take another group of people and you put them on a placebo, sugar pill with no medication. The FDA will not allow us to do a placebo-controlled trial in hypertension anymore. Now, you can do a new medicine versus an older medicine or a device versus medication, but you can't do take a pill versus another group take a sugar pill. Why is that? There was a study in the 1960s called the VA Cooperative Trial. It were mainly men. Their blood pressures were in the 160s, so they were in the red. One group took medication, another group took placebo. After 2 years, half the people who were taking the sugar pill had a heart attack, stroke, or were dead. And what I tell my patients, I don't want you to be in the placebo group. Take your medicine.
That's right. That's right. And we hear so many reasons why people say, I don't want to take my medicine, or why they don't take their medicine. How do you counsel someone, Dr. Eccles, when they come in, especially our men?
Yeah, so it's I will say this, patients are, first of all, I always tell patients, you know your body better than I do. And there are sometimes whenever you're taking medicines that you might have some side effects from it, particularly if you have a really high blood pressure and we're trying to get it down to a reasonable number. A lot of times people who've been living high very long, if you bring it down, 10 or 20 points, sometimes they feel extra tired and extra what we call lethargic and just want to sleep a lot. And so we usually try to temper that by telling people what you can expect to feel, number one. The second thing is we try to empower people to hold on. It gets better. You get used to it. And then thirdly, we often say, you want to communicate with your doctor. And you don't want to just stop stuff just to stop stuff. So if you're feeling like a medicine is causing a problem, talk to the doctor. And if they're, worth their, weight in salt, they'll listen to you and they'll try to figure out another option for you. Because go ahead.
I'm agreeing with you, Dr. Eccles, and I was going to give you a little clinical pearl. I have clinic tomorrow, and I'm down here in New Orleans, so I'm treating some high risk patients. So here's what I do. I'll say to them, you ever been to California? And most people from Louisiana got somebody out on the West Coast. Oh yeah, my aunt lives out there. I say, oh, have you visited her? And they'll say, yeah, I went last year just for a little bit. I say, oh, you walked, huh? And they look at me, walked. And I said, well, how did you get there? They said, well, I caught a plane. Or I said, well, you're using technology to go visit your aunt. You should use the technology to control your blood pressure. Or I can make the story control your diabetes or control your cholesterol. So I really think we should get away from this idea that that's unnatural. It is part of the plan. We're human beings. We have free will. We can modify our lives.
And realize that blood pressure, a lot of times people will look at blood pressure numbers and they will see blood pressure in the 120s or 110s, and they'll say, oh, that's way too low. That's way too low. Because, they, first of all, I think research and the medicine field has a little bit to play in this, because we've constantly been changing numbers over time. So we've reduced and reduced and reduced. And that's because we found out that at several levels, even past 120, so past 120 over 80, 121, 122, you still have an increased risk of heart attack, strokes, all those things than somebody with a lower blood pressure. So especially if you're elderly and so I think that this is a very, very important point. You don't necessarily go look at the numbers in terms of how you feel, in terms of whether you should stop taking the medicine, but it's really how you are feeling on the inside. If you are feeling fine and your blood pressure is 110 over 70, that's great. Keep it there.
That's right. Exactly. And don't stop medicine without talking to your healthcare provider, because it's probably normal or low because you're on your medicine. So thank you. Thank you both for sharing that. And, we've heard you both mention stroke, and either one of you can take this. What is a stroke? Like, how does it happen?
I think we have another figure that can go up. I'll just introduce it, and Dr. Eccles can go into more detail. That's the signs of the heart attack. We discussed that. And if you notice, put it back up just for a second. If you notice, it's not just the Fred Sanford syndrome. They included shortness of breath, nausea, vomiting, even back or jaw pain. Those are the things that Dr. Eccles and I were discussing, that you don't have to have the classic red fox type of heart attack. If you have any of these symptoms, especially if you have shortness of breath and you're sweating, you're dizzy, you're weak, you should seek medical care, because you may be having a heart attack. The stroke is the next one we were going to put up. And I'm going to let Dr. Eccles go into it, but I should mention the reason they call it stroke is because it happens sometimes very quickly, like a stroke from God. The person is sitting there watching television and just slumps over, or they're driving on the interstate and the car starts to swerve, it hits a tree, and they find the person can't move or can't speak. So that's why they call it a stroke. Dr. Eccles, you can talk about those warning signs.
Yeah, so this is excellent. So this is a very quick way for you to remember, whether or not there's an acute stroke happening, and it's called FAST, with just cause, but really the F stands for face drooping. So if you're now everyone to some extent has a little bit of sort of dissymmetry, or sort of their face on the same side doesn't really quite look the same. But if you notice that in the mirror, your face is dramatically drooping on one side, as well as your lips, and whenever you talk or whenever you smile, nothing is happening, that is something to definitely be concerned about, particularly if you're touching your face and it's numb as well. Then there's also arm weakness. So whenever you have a stroke, depending on how big it is, sometimes it can affect the entire side of one side of your body. And so if you notice that your arm is really weak, or you can't lift it, or you lift it and it just kind of drifts downward, that's pretty much telling you something's going on, something's wrong. At least that's enough for you to go to the emergency room to get checked out. Then obviously, if there's some speech difficulty, and speech difficulty can be anything from slurring of your speech to you can't find the words to say what you want to say. And so if somebody's looking at you and asking you, what's wrong, And you want to tell them, I don't know, but you can't get it out. That's a problem. That is something that you need to be alarmed about. And then T, time to call. So 911. Whenever you have any of these things happening, I don't care, where you are. If it's happening, you need to call 911 so that they can come and assess you, because there are definitely some things that will need to happen immediately for people who have what we call acute strokes. There are other stroke symptoms as well. We talked about the numbness, the confusion, sometimes definitely trouble seeing, trouble walking, severe headaches. And then I want to make sure people also know this. You can also have strokes where you just all of a sudden get this intense dizziness, and it just does not go away, and you're not really sure what's going on. And sometimes that's a stroke in a certain part of the brain that causes no other symptoms but that dizziness. And if that's the case, again, you may not know what's exactly going on, but go get help.
Thank you. This is so powerful. I mean, you all are really hearing from, again, two cardiologists who do this day in, day out. They're sharing this information with us. So, please, if you have questions, please put them in the chat. And Dr. Eccles or Dr. Ferdinand, you'd mentioned the stroke. We talked about it. What about mini strokes? People talk about TIAs. How are they
Well,
different?
I have something very interesting to share with the audience. Mini, MINI, means small. So what Dr. Eccles was describing was a stroke that probably is sizable. Sometimes it's so small that all you have is a piece of your eye you can't see out of, or your tongue just feels numb, or your hand it's a little clumsy. You can't write as well. And then it might go away. It can be reversible. That's called a TIA, transient ischemic attack. So it may not be the big stroke. You could have those little bitty strokes that are warning signs. But here's another point I want to drive home. In the 1900s, a doctor named Alzheimer's described the condition in the brain where there were plaques in the brain and the person lost their ability to think. That disease now, Alzheimer's disease, is kind of used as a garbage term. What I mean is we just throw everything in the bucket every time somebody loses the ability to think. Many times, those are mini strokes. It's not Alzheimer's. Uncle Joe didn't have Alzheimer's. Uncle Joe had diabetes, high cholesterol, and hypertension that wasn't controlled, and a small blood vessel clotted off, and that's why he's acting like that. So let's be careful not to blame everything we have in middle age and older persons on Alzheimer's. Sometimes that's actually the effects of a stroke.
And what you also should remember is that even though you might have one of those little symptoms that go away, just the mere fact that you had that severely increases your risk for a major stroke within 30 days. So we've got to be careful about that. So if you have something like that, again, go get checked out so that people can do what they need to do to hopefully prevent that from happening.
Thank you both. Both of you just touched on something that we really wanted to delve into now in this next segment here about being better advocates, asking the right questions. And just for myself, before both my parents passed, just taking them to the doctors, having a notebook basically of all their conditions, all their medications. I wish I could do the same for all my family members because they come back from the doctor, they're asking me questions, right? And I wish I were in the room with them. I took one of my family members today to the doctor as well. But what are the questions? What things should we be asking our healthcare providers when we go in? You can start with heart health, but you can make it general as well.
Dr. Yabo, that's probably one of the most important components. And I said this in the beginning, I'm going to stick with it. One of the most important components of taking care of yourself is being able to communicate with your healthcare clinician, whether it be a nurse practitioner, or physician. Here's the things that I would do. Don't let them just check your blood pressure, take your blood and run it down the hall to a machine, and you don't know the numbers. Miss Brown, your blood pressure is a little bit up. Oh, I'm sorry to hear that. What is my number? Miss Brown, your sugar's a little bit up. Well, I'm sorry to hear that. What is my glucose? Is it at the level where you're making a diagnosis of diabetes? Your cholesterol is a little bit up. You need to eat a little better. Well, what was my cholesterol? If you don't ask those questions, you won't get the answers. And you may live for years with less control of your blood pressure, Less control of your blood sugar leading to diabetes, and eventually that can lead to blindness, kidney failure, or losing your toes. Less control of your cholesterol, and that chicken grease that you pour down the sink and clogs up the zinc, it can clog up your heart. So here's what I suggest. Be an advocate for yourself and your family. What Dr. Yabo did with her family, all of us should do with our family. And even though I'm a doctor, I will advocate for my family. I'll tell them, yeah, tell the doctor, call me after he sees you. Or if you're going to have a procedure done, find out the name of the procedure, the risk, the benefits. If you're not going to do that, you're going to be a passive patient. Passive patient means you just sit and let them do whatever. And we know that bias is in education, transportation, and healthcare. Bias is everywhere. And you can break through bias by making the clinicians talk to you and talk to you straight.
Excellent, excellent. Anything to add, Dr. Eccles? Thank you, Dr. Ferdinand.
No, I mean, Dr. Ferdinand has a way of putting it to you where you understand. I got in trouble so much for pouring grease down the sink, so that's why I left. But I do want to make a point of talking really quickly about men and cardiovascular disease, because this brings us to a point of where we're talking about empowerment and knowing your numbers. Men, you cannot rely on your wife to know all of your information and do everything for you and take the pills for you as well. Now, don't get me wrong. Wives are a godsend for men a lot of times, especially Black men, because what'll end up happening is they'll both come in, and you'll talk to the Mr. Johnson, how are you doing today? How's your blood pressure been? Oh, it's been good, doc. Nothing's wrong. Then you look over to the side and you see, the wife side-eyeing him or looking at you like, So, it's a really nice balance. But I will say women are amazing in terms of how well they can care for the family, their husbands, everybody. And they really need to make sure they're taking care of themselves as well. But one of the things that I want to make sure men do is know your numbers, be in charge of your health. Don't wait for somebody to do it for you.
Dr. Yabo, can I make a great point?
Sure.
It's like Dr. Eccles and I, we've been knowing each other. We've worked together, but not in the same clinic. But it sounds like we've been in the same clinic. The husband and wife will come in. The man will come in, blood pressure's up, or he may have diabetes. And you'll say, okay, what medicines are you taking now? And he will actually physically turn and look at his wife to tell me what medicines he is taking.
And she'll roll them off without looking at anything.
That's right.
You've had that happen, huh, Dr. Eccles?
Yeah, several times.
Yeah, we have an exactly in the chat. Someone's affirming that. No, great advice. Great advice for our men and for our women. Something you said also, just letting our women know also that they can't always be super women, right? We can't always take care of the entire family and not take care of ourselves. Self-care is important. We have to be healthy to take care of everybody else. So,
Right.
yes, thank you. Thank you for sharing that. I wanted to see if there are any more questions that's coming through in the chat. Let me see here.
So this is a really interesting question here. Miss Hickey says, I take my medicine for years. However, I've been told that my medicines have an impact on my kidneys. So this is the situation. So there are medications that we use that we have to be careful because they can have kidney side effects. However, the most common time or reason why we're getting problems with our kidneys is because we haven't controlled the blood pressure. So because the blood pressure isn't as controlled, but you've still been taking medicines for 20 years, and now you have kidney problems, now we think, oh, it's got to be the medicine that I've been taking for 20 years. So no, this is a misconception that I really want people to understand. A lot of times it's because your blood pressure has not been at target for that long. And so you really have to have a provider that really understands, the physiology and sort of the medicines. and able to talk to the patient, because a lot of times that's what's happening.
Yeah, break it down a little bit. Tell us that relationship between high blood pressure and kidney disease. Like what happens there? Yeah.
Dr. Renan, you want to do it to me?
I can go. So the kidney actually has a lot of little blood vessels in it. And the same pressure that's in your arm, that pulsatile pressure, is going throughout your body through the aorta, the main big vessel, and then it goes to the kidney and it hits those kidneys and can damage those little blood vessels. Here's the example I use. If I took a hose pipe and I opened up the nozzle and I put it up against the wall, it wouldn't do much. But if I kept that pressure on that wall for hours, you come back, I'd have a hole in that wall. So the pressure that's in your arm, again, is really not as important as the pressure that's inside. And that pulsatile pressure hitting the kidneys can damage the arteries, the little blood vessels in the kidneys, and it can lead to kidney failure. In the Black community, 33% of the people on dialysis are Black. We're not 33% of the population. And it leads to total disability. It totally disrupts your life. You can't have a meaningful employment anymore. You become disabled. You get on Medicare. And go to that dialysis unit. And I suggest everybody just peek in. And you're going to see people in their 30s and 40s and 50s on dialysis.
So we've got to control that blood pressure.
We got to do better.
Sugars, keep our sugars at a normal level because they're all related. Now we're in this, never-ending pandemic with COVID, with flu. How does that impact someone who's battling high blood pressure or diabetes?
Well, in New Orleans, we have a community intervention program. I work with Cherish. That's the church-based program. And you can look it up as CHERIS, Cherish. And the reason you should know about it, because it's your tax dollars at work. It's a grant from the National Institutes of Health. We're in 42 churches in New Orleans, African-American congregations, all various denominations. And we're using nurse practitioners. Those are nurses who can prescribe, and community health workers. Those are persons who don't even have an advanced degree, but we teach them how to show people how to check the blood pressure. We measure the glucose or the sugar for free, the cholesterol. And what we're trying to see, what NIH is trying to see, is that if you go into a community setting, you can control these risk factors. Those boys on the interstate popping wheelies, if you can, slow down a little bit and start to drive more safely. I'm using that as an example. But here we're talking about blood pressure, glucose, and cholesterol. Now, the answer to your question is what we can do. What we can do is stop embracing this as part of being Black. And again, Dr. Echols and I have known each other for decades. The same thing that I'm about to say, he's going to nod his head. Mrs. Brown, your blood pressure is 160/100. We need to control your blood pressure. Oh, baby, that's just my pressure. It's been like that for years. That poor lady has been taught that having elevated blood pressure is part of her intrinsic makeup. It is not. It is not. We are not supposed to be dying from heart disease and stroke at an early age. It is not part of our natural makeup. So your question is what we can do. Well, we talked about knowing your numbers. We started out with getting a good night's sleep. Take your medications. Make sure you're eating a heart-healthy diet, mainly fresh fruits, vegetables, lean sources of protein. Physical activity. If you work in a sedentary position in the workplace, then you have to build in that half hour to 40 minutes of aerobic activity, light weightlifting. You don't have to, bench 300 pounds. You're not going to play in the NFL, 25, 20, 15 pounds, 2 times a week, 150 minutes a week. And there's some new studies that now say you don't even have to do the full 10,000 steps. Anything is better than nothing. And women appear to get even more benefit than men. So that's a long answer to your question, but those are the things we can do to reverse this situation.
That's
and
right.
For the physical activity, you don't all have to do it all at once in one day. You can actually split it up and you still get the same effect, like 10 minutes at a time. So just remember that. It doesn't have to be a whole 40, 30 minutes or so, but you can split it up if you need to.
Some wonderful prevention tips there. And of course, getting vaccinated.
Oh,
Yeah,
I left that part out. Wait a minute.
yeah, go ahead, go ahead.
She gave you a layup, and you just
I just kept going. Look, I shot a 3-pointer, and I was so happy. I shot another one. She said, "Wait a minute, I had shoot." The same people who died from heart attacks and strokes died from flu and COVID. And in the African American community, because we have higher rates of the conditions that we're discussing, we had higher rates of death from these viruses. Part of what we do in New Orleans is also assist people with immunization. That's also part of God's plan, our ability to stop getting exposed to these conditions. Historically, I'm gonna go out in deep water just for a second, Dr. Yo, but we're not gonna be out that far in deep water, but I'm gonna get out there a little bit. Historically, we thought the Europeans were able to conquer the non-industrialized, non-westernized world with those muskets. But let's think clearly. Those little stupid muskets didn't kill all those people. What happened was many of them were exposed to viruses and did not have any immunity. So yeah, they may have shot some people, but they also sneezed and coughed on some people and killed a lot of people throughout the non-westernized world. So we can prevent some of that with vaccination.
And I know our people. I know our people have some trouble with vaccinations sometimes. But again, as Dr. Ferdinand says, God has given us this technology to help us. And I will tell you, for COVID, I always used to set it up like, so the first people that actually got the vaccine were healthcare workers. So I would tell people, I've already been the guinea pig for you, so you can take it. It's okay. I think that at the end of the day, we need to make sure that you are very careful with understanding that there is such an increased risk. Even though you've been healthy as a horse all your life, if you get flu, you can develop heart failure. You can die. And these are like huge things. Of course, you think, oh, this will never happen to me. But I can tell you, firsthand, you sometimes think things never happen to you until it does. And so, you have to be careful.
I know, you really do. And we're thankful for you for, your comeback, Dr. Eccles, and feel free to share if you like.
Yeah. So I actually, I'm a little sweaty. So, but basically, so I last year, I had a little procedure outside, and I was, at the top of my game, publishing, speaking at conferences, doing all these things. Had a little tiny procedure outside. Actually suffered a complication and ended up in the ICU for 4 months. I was on dialysis. I was, liver failure. Several different surgeries. For all intents and purposes, without God, I should not be sitting here today. But God.
Amen.
And I look back at this, and I've looked at all the pictures of the surgeries and all these things, and it boggles my mind how I was at a place just as quick as like night and day, but then over time, God kept me and prevented prevented my demise. And before you know it, I got off of dialysis one day. The doc came in and said, well, I guess you don't need dialysis anymore.
Amen.
And then, one day a doctor came in and said, yep, well, you're not having fevers anymore, so we'll take you off of these medicines. And it continued to happen like that until one day I was out of the hospital. I had lost 90 pounds. I had to learn how to walk, talk, eat again, all of these things in the matter of 12 months. And so, my thing and what I will tell you is I had firsthand experience that the patient side or the patient life it sucks. There's no way to put, we talk about a lot of things. We talk about improving healthcare and improving health equity, but at the patient level, when you have, people just kind of doing their job and really, not putting it together for the patient, you feel lost, you feel helpless. And I, as a doctor, as a cardiologist coming out of the hospital, had some of those same feelings. So I know how hard it is to, come from a situation and realize you got to get back up on the horse and keep it moving. I know how hard it is to have all these things happen, but dare not question God, because Yeah, I'm not gonna go there, but I would just I'll just tell you this, that I'm just thankful to God that He allowed me to be here. And again, this happened literally like 1 year ago, and I'm thankful to be here to tell the testimony.
Amen. Amen. All praises to God. And you can see that your Shaw Temple family, everyone's just praising and thankful. We're all thankful for you. So thank you for sharing that testimony, and just being vulnerable. So you've heard it. I mean, you've heard it from our cardiologists, you've heard their personal experiences, but just heard, you just have to know your numbers, be advocates for yourself, for your family members, and just take one step in the right direction, whether it's starting to walk for 15 minutes tomorrow, just something in the right direction. Get vaccinated, know those numbers. And before we close, I just wanted to turn back to both of our panelists, see if they have any parting words for us.
Well, my only parting word is those were powerful words from Brother Echoes. As I said to you before, we've been knowing each other for years, and I didn't bother him much. I just popped a couple of emails, "How you doing, bro? What's going on?" And he'd send back some cryptic stuff. But as long as something was coming back, I was happy. I didn't pry. I didn't ask for details. As long as he said I'm getting better, I was happy. So I'm glad you're back, Brother Eccles.
Yeah, I'm so thankful. I'm so thankful. Everybody, Dr. Ferdinand has been an amazing mentor for me. And that's why, Dr. Yabo, when you said I was going to be speaking with him, I said, I'm good. I haven't seen him in a while. This is going to be like catching up with him. So this is great. Thank you so much for this. And, for everybody out there, just always remember God is in control. But you have free will. And what you choose to do with your free will is what you choose to do with your free will. Okay. So just remember that. Stay blessed. And thank you so much for inviting me, Dr. Yabo.
Oh, thank you both so much for agreeing wholeheartedly to be here and just for sharing this wealth of knowledge. People wait months to see a cardiologist. I know that for a fact. Um, and so to have the two of you willingly come on today and share your pearls of wisdom has truly been a blessing. And I hope everyone take heed to that. Share this. It's going to be on demand on AMZ TV. You can watch it again and share this program with others. We are going to continue in the series next month. We'll have a nutritionist come and speak with us. But she's going to make it plain, talking about how to eat right, what are proteins, what are carbohydrates, what does it mean to check the box in the back of a package, what does all that mean? And then we'll also have someone that you all know very well, who's going to be on the panel with her. I won't spoil a surprise yet, but just telling about her journey and how she made a complete 360 in her life. So just wanted to again say thank you. Want to now turn over to Brother Kent to close us out. And thank you again to our panelists. This has been awesome.
Okay, Dr. Yabo, we have to have a talk after this because I guess this would be a little bit of a double entendre. Where did you find these two gentlemen from?
Okay, well, let's start. Dr. Eccles.
This is like rhetorical question. We'll talk offline about it. But then again, where did you find these gentlemen? Because they hit right here with me.
That's
on
right.
so many levels. I, as a Black man, began to almost tear up hearing about how we don't advocate for ourselves, how we don't know the definition of some of the things that we are dealing with when we go into these doctors' offices and we just allow them to work on us. What you said, passive patient? That was the first time I heard that term, but it's so true. You hit home when you talked about how my wife does pretty much everything for me medically related. That is not good. I shouldn't be advocating for myself. I know she's probably listening in the other room and she's going to get me and probably replay that clip over and over again. But listen, has been tremendous. The tremendous wealth of knowledge that you both offered to the entire Amy Zion Church and beyond has been exceptional on this evening. I thank you both. I thank you, Dr. Yabo, for putting this together. And if this is a preview of what you're going to be bringing to the Star of Zion and Amy Zion Church, we are in for a treat. Listen, Amy Zionites, I need you to say a word of congratulations in the chat right now to our guests, to Dr. Yabo. And also, please, let me get this off the screen. I need you to subscribe to the Star of Zion, starofzion.org. The way that we are able to do panel discussions like this and be able to reach the masses, right? For the good of the church and for God's grace and his divine glory and everything that we do. We want to be able to do more of this, but we need you to be able to invest in what we are doing here. And the way that you can do that best is going to starofzion.org, subscribing today, hitting that advertising. If you want to advertise with the Star of Zion, please let us know. We're able to take that on as well. The congratulations are flowing in. Listen, I'm not going to talk too much more about it. We're leaving on a high note. And thank you once again, everybody, for watching. Thank you for participating, Dr. Eccles, Dr. Ferdinand, and definitely Dr. Yabo. God bless everybody on tonight. Have a great night and look forward to the upcoming Prescribing Positivity series. We'll keep you abreast with our social media and everything that we're doing in the Star of Zion. God bless you on tonight.
God bless you. Thank you so much again. Thank you.
Amen. Amen.
Amen.